Welcome to today's Explainer. I am absolutely thrilled to have you here because we're looking at something that honestly feels like magic, but is actually a profound engineering marvel. Have you ever really thought about how doctors can just look right inside us? Today, we're uncovering an acoustic trick that happens thousands of times a day in hospitals all over the world. We're talking about the mind-bending ability to literally see with sound. We're going to break down the hard science here and see exactly how frequencies way beyond human hearing are being harnessed to save lives.
Okay, let's dive right into this. What if sound could actually help doctors see inside your body? It's kind of a paradox, isn't it? Because normally we use our eyes to see and our ears to hear. Sound is just a physical vibration. It's pressure waves traveling through the air, completely invisible to us. But somehow modern medicine figured out a way to take those invisible physical waves, bounce them off human tissue, and use that to give us literal, high-definition medical vision. It is absolutely wild when you really think about it. We are literally taking physical pressure and turning it into an anatomical map.
Sound that can actually see. That's the core acoustic phenomenon we're dealing with today. It's so cool that doctors can look deep inside a patient without making a single cut. It almost feels like a superpower. But honestly, it's just a brilliant spin on echolocation. Think about it. It's the exact same evolutionary tool a bat uses to fly through a pitch-black cave, or the sonar a submarine uses to chart the deep ocean. Today, we're going to see exactly how these invisible physical vibrations are caught and turned into the crystal-clear pictures that guide massive medical decisions every single day.
Section 1. What is ultrasound? Let's take a look at the science of sound.
So ultrasound is basically a medical imaging technique that uses high-frequency sound waves to create pictures of the inside of the body. But I really want to highlight that phrase, high-frequency sound waves. To get this, we kind of have to think about our own ears. The absolute highest pitch a healthy human ear can perceive is around 20 kilohertz. That's 20,000 cycles per second. But medical ultrasound? Oh, it's in a totally different stratosphere. We are talking about the 1 to 18 megahertz range. That is 1 million to 18 million cycles per second. So this vision isn't driven by lasers, and it isn't driven by radiation. It's driven purely by acoustics, pitched so exceptionally high that while our ears are completely deaf to it, specialized medical tools can harness all that intense physical energy. So the crucial point here is that ultrasound equals sound waves plus images. The whole technique relies on this beautiful, simple jump from an acoustic input to a visual output. But how on earth do they do that? Well, the secret sauce is something called the piezoelectric effect. Inside the actual ultrasound wand, there are these highly specialized crystals. When you zap them with an electrical current, they rapidly change shape and vibrate, which shoots out those multi-megahertz sound waves. And here's the crazy part. It works in reverse, too. When the bouncing sound waves come back and hit those exact same crystals, that physical pressure creates an electrical current. The computer then translates that returning current right into an image. It is just this seamless loop, electricity to sound and sound straight back to electricity.
Section 2. Send, reflect, create. Let's look at exactly how this goes down inside the body.
Let's break down this incredibly elegant three-step process. Step 1 is send. The doctor uses a tool called a probe, and when it touches the skin, those piezoelectric crystals we just talked about shoot high-frequency sound waves right into the body. Then we move to step 2, reflect. As those sound waves travel inside you, they don't just stop. They hit boundaries between different types of tissues, like where fluid meets solid muscle or soft tissue meets bone. Because these materials have different densities, they have what's called different acoustic impedances. And because of that difference, part of the sound wave bounces back as an echo, while the rest keeps going deeper. Finally, step 3, create image. Those bouncing echoes return to the probe, and the machine maps them out. The time it takes for the echo to return tells the computer how deep this structure is, and the strength of the echo tells it how dense the tissue is. Boom, that's how it draws the borders and shapes. Send, reflect, create. Section 3, examining the body. Now let's explore where doctors actually use this trick. And this brilliantly illustrates the sheer versatility of ultrasound. I mean, doctors use it to examine the beating heart, that's called echocardiography, giving them a real-time live view of valves and chambers. They use it to scan the abdomen, inspecting internal organs like the liver, kidneys, and gallbladder for any issues. And then there's Doppler ultrasound, which actively monitors blood flow.
Doppler relies on the Doppler effect. It actually measures the subtle change in the pitch of the sound waves as blood cells move toward or away from the probe. You know when an ambulance drives past you and the siren changes pitch? It's literally the exact same principle, just happening on a microscopic scale to map your vascular health. And of course, it's famously used to safely monitor pregnancy, giving us those stunningly clear views of the developing baby.
Section 4. The safest imaging tool. Let's discuss why this tech deserves a standing ovation.
Ultrasound is widely considered one of the absolute safest imaging tools in medicine. To really appreciate why, you gotta compare it to other diagnostic tools like X-rays or CT scans. Those technologies rely on ionizing radiation, high-energy particles that easily pass through the body, but carry a tiny risk of damaging cellular DNA if you're exposed too much. But because ultrasound relies entirely on harmless, non-ionizing sound waves and returning acoustic echoes, that risk profile basically drops to zero. It's an incredibly gentle way to gather structural data. And that utter lack of radiation is exactly why ultrasound can be used to give doctors continuous, real-time video feeds over a long period of time, instead of just one quick static snapshot, with zero danger to the patient or the physician. There are just so many more layers to this technology, and it's incredibly rewarding to explore as you continue to deepen your knowledge of medical tech. The field is evolving so fast right now. We're talking everything from massive hospital machines to pocket-sized portable ultrasounds that literally plug right into a smartphone. Plus, the software has gotten so advanced that we now have hyper-detailed 3D and 4D imaging. It's an absolutely phenomenal space for anyone who's even a little bit fascinated by where human biology meets physics. Be sure to seek out more knowledge on this from the original source material if it sparks your interest. So I want to leave you with one final thought to ponder as we wrap up this explainer. If diagnostic sound waves provide the absolute safest way to see our hearts and organs today, what other hidden secrets of the body can sound help us uncover tomorrow? Think about therapeutic ultrasound. Not just asking what sound can see, but what intensely focused, high-energy sound waves might actually be able to heal or even destroy. Like imagine non-invasively targeting and breaking down an internal tumor, just using sound. The potential here is literally vast. Thank you so much for hanging out with me today, and keep exploring.